Technology has made the quest for a better-looking body easier. To tell us what modern plastic surgery can achieve, we're speaking with Dr. Marc DuPéré of Skyview Cosmetic Enhancement Center. This is Daily Web TV. Today I'm speaking with Dr. DuPéré about some less common plastic surgical procedures on the body that you may find quite interesting. Dr. DuPéré, I understand that you do some procedures that are done by very few plastic surgeons in Canada. Let's talk about those.
Well, some of those are pectoral implants that we do on guys, and also buttock implants and calf implants that are done on guys and girls, bodybuilders and non-bodybuilders.
So I understand the pecs, that's pretty self-explanatory, but I'm quite interested in the calf implants.
Yes, it's been a newer procedure now that I've been performing for the last 5-6 years. I find it a very gratifying procedure for guys and girls, bodybuilders and non-bodybuilders. I think any ladies like to have a nice calf when they wear the shorts, dresses, for example. Mm-hmm. And the beauty of this procedure is that the incision is well camouflaged, hidden in the crease behind the knee.
Now, is this more commonly done by people who, because some people really don't have any calf, just, genetically, or is it because the calves fall with aging?
It's not because of a fall.
Okay.
But we have the athletic muscular patients who come and fail to grow their muscles. So this is one type of patient. And there are other patients who come and it's just a lack of definition or a lack of calf size that they want to have a small enhancement.
Okay. Now, buttock lifts, very interesting. I know quite common or popular in South America, is that correct?
Yeah, Latin America, South America, now Florida, California is a common procedure, and it's coming up slowly to Canada.
Now, is this similar to like a breast implant, but it's in the buttocks?
They're slightly different implants. Breast implants, as we know, most of them are cohesive gel implants. When we use pec, calf, and buttock implants, they're solid implants. They're made of silicone, solid, but they're like cushion-like, a little bit like gummy bears.
Okay, okay. And the procedure is, I would imagine, quite large.
Well, no, actually. It's still a longer procedure, about a 2 to 3 hour procedure for the buttock. It's done through a small 5 to 6 centimeter incision right in the crease between the two buttocks, and through one incision for the buttock, we can put both implants in place.
Now, is this an implant that's in the lower buttock designed to kind of lift? Is that the idea of it, or is it to create shape?
It's to create shape, and it's not located in the bottom part of the buttock. It's located in the upper half of the buttock to achieve the lifting maneuver.
Very interesting. What about in breast augmentation? Is there anything new, techniques?
Techniques are all similar as in the last few years, but there are newer implants on the market, such as one implant that's form stable, has a teardrop shape, has also a texture to it that prevents rotation or migration of the implants. And because the cohesive gel is a high cohesive gel, it allows to get a very powerful lift for patients who may require a lifting procedure but do not want to have the scars of a mastopexy.
How long can you expect an implant to last?
Well, there's no definite deadline for a change in implants. And I tell my patient, if the implants look good, if you like the shape, if there's no sagginess, if you like the volume, then there's no need to change them unless there's a problem.
Really? Okay, so you can potentially have them for a lifetime.
Yeah.
That's really interesting. Are there any other applications for these implants we've been discussing?
Yes, particularly for breast implants and buttock implants. I use them more and more now in my patients who've lost a significant weight, either with the laparoscopic bending or any other ways. Often the previous lifting procedures involve large incisions, which often can be managed now with smaller incisions and implants, or a combination of a traditional lift and restoration of volumes with the implant.
Fantastic. That's great news for people that are undergoing weight loss. And I imagine they should probably see you before they undertake that.
I think it would be very important that those patients, before they get into the surgical part of the weight loss, that they consult a plastic surgeon to get the real expectations of what a significant weight loss would give them in their bodies and to see the options that they have to restore their body shape.
Great information, Dr. DuPéré. And if someone would like to contact you, how can they go about that?
They can go on the website at skyviewspa.ca.
Thank you so much. Well, now you can have it all from head to toe. Skyviewspa.ca for more information. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.